Hi there. Snigdha has asked me, Snigdha Sharkar, one of my followers in my YouTube channel, has asked me about an intriguing gynecological problem. She has asked if somebody has both polycystic ovaries and an endometriotic cyst, chocolate cyst, in the ovary. This combined two pathologies. What are the risk factors and what would be the treatment? So I had promised her that I would tell her about this. Now, let me go one by one. Maybe one of the ovaries is polycystic in nature. Once there is a chocolate cyst in ovary, it would be very difficult to get the normal ecotexture in ultrasound to find out the ovaries and also diagnose a combined PCOS. Let me consider for the fact that one of the ovaries has a frank polycystic ovarian syndrome effect. Means there are multiple cysts at the periphery of this ovary. Now, we have heard so much about polycystic ovaries. Basically, polycystic ovaries is a condition, it's a manifestation. This polycyst, multiple cysts in the ovary, is a manifestation of the condition, and the basic pathology, the basic condition is resistance, insulin resistance. That person, that lady, is inherently resistant to the endogenous insulin. That causes multiple abnormalities, symptoms and signs, of which there is formation of multiple cysts in the ovaries, some obesity, there may be hair growth, and also there may be problem in cycles, like there would be delayed cycle, etc. Now, we are, as Indians, very prone to diabetes, and this gene of polycystic ovaries is linked to the diabetes, gene of diabetes. So, it's very common. There's not a single day when I don't see a polycystic ovary in my clinic. So, it's very common among the young ladies and young girls, even the school-going girls. The main risk factor is that in the later age, they may develop diabetes, cardiac problems, etc., and even in a very late stage of their lives, uterine malignancy. But I'm more worried about the diabetes and cardiovascular problem, which are very common among the Indian population. So I tell them simply that you are born with a weak pancreas, you are born with a Maruti 800 engine. So try to remain as such. You would be very prone to obesity, so try to do exercises, good lifestyle, maintain your weight, fruits and vegetables, exercise, etc. Maintain your weight, keep yourself a Maruti 800 because your engine is like that, a small engine. So if you remain healthy and your weight is under control, you're living a very healthy life with exercises, ample exercises, then this polycystic ovaries may not cause any major problem in your life. As far as the reproduction is concerned, I have seen so many polycystic ladies from very young age, and they have delivered under me. I'm not that worried about the reproductive problem of these ladies. They may have delayed cycles, and again, to correct that, if they want a baby, we can go in one pathway, and if they don't want a baby, then we can just prescribe oral contraceptive pills. As far as the endometriosis is concerned, maybe the other ovary of this lady has endometriosis. It's the backflow of the menstrual blood which started to remain alive inside the abdomen and bleeding each month inside the abdomen, like the ladies having period outside from the vagina. Now, this bleeding inside slowly collects over the ovaries like a liquid chocolate material, and this is known as the chocolate cyst, endometriosis. Again, endometriosis is very common. It also has some genetic predisposition. Some families, some ladies are more prone to develop it. Now, the main problem with endometriosis is that the environment becomes highly inflamed, and the environment inside the abdomen near the ovaries and fallopian tube, where it's very important for the reproductive ability, becomes a very much disturbed by uh, macrophages and abnormal cells there. Well, I simply say that, like, your environment has become full of goons, so we have to correct that, so a normal pregnancy, normal egg and sperm cannot meet. So yes, endometriosis, even without a chocolate cyst, even a small amount of endometriosis, by altering the local environment around the ovary and the fallopian tube, can impair fertility, can cause problem with getting an issue. On the other hand, now, pregnancy is one of the most serious enemy of endometriosis. If somebody has a pregnancy, the endometriosis recovers by the hormonal effect of it. So in these two conditions, for example, if a lady has these two conditions, my only question would be that, do you want a baby now or do you don't want a baby? If she doesn't want a baby, then I can go for the endometriosis treatment, like with medicines like Gynaecologist. If a large cyst is there, she may think of some cystectomy, laparoscopic cystectomy, an operation to remove the cyst. Or she can take certain oral contraceptive pills, which has Gynaecologist in it, which is also a treatment, as I said, of endometriosis, and that would help her. Now, if this lady wants a pregnancy, I cannot give Gynaecologist, I cannot give oral contraceptive pills, then she cannot become pregnant. So in that condition, I will more concentrate on induction of ovulation and tell her to stay together regularly during each cycle so that they can get a baby. Once she gets a baby or her family is complete, there are loads of available options for the treatment of endometriosis. Endometriosis hardly ever turns malignant. And again, polycystic ovaries, as I said, may have a small predisposition of uterine malignancy at the end of life, but it's very rare. More troublesome is that she can develop diabetes, cardiovascular problems in early age. So Snigdha, I hope in this nutshell I told you about these two conditions, which I would rather make separate videos for this. Those who like these kind of topics, they can please subscribe to my channel and leave me your comment below so that I can make videos for you. Have a great week and listen to good content in YouTube. You can learn a lot of awareness from those. Bye.